Hello everyone, welcome to Health Matters with Dr. Angie. Irrespective of where you are coming across this video, I send you special greetings. So I believe we are doing fine. I believe we are keeping up with the challenge wherever we are. I believe we are pushing hard. I believe we are being optimistic and being positive and giving life the best of us in everything that we are doing. Okay, in today's discussion, I want to be talking about immunization or vaccination. They're actually not the same thing. There's a difference between immunization and vaccination, but for the purpose of this teaching, just allow me to use it interchangeably today. Maybe another day, I will be able to explain to what's the difference between immunization and vaccination. So, it baffles me that despite the amount of sensitization and awareness that has gone into vaccination and immunization, especially in children, some parents still don't accept their children to be immunized or vaccinated. So I want to briefly tell us about the importance of immunization today. You see, there are some diseases that are likely to kill children or kill a child before his or her 5th birthday. So what am I trying to say? There are some diseases that children less than 5 years are likely to have before their 5th birthday. And if not well handled, it can lead to their death. Of course, we know that immunity is low in that age bracket, extremes of age, the very young and the very old. So what science has done is to bring about vaccines that can help prevent these diseases in these children before they are, that will give immunity to these children so that even if they finally contact these illnesses, it won't be as severe as it would have been if they were not vaccinated at all. What are some of those illnesses or diseases? Diseases like polio, diphtheria, tetanus, measles, yellow fever, and all that. So the pneumococcus infection and all what have you. So what the vaccines does is that they get into the system and they help your child build immunity. Of course, we know that immunity can be acquired or developed. So in acquired immunity, you are like sensitizing the body to develop these antibodies that will help fight against these diseases. So when your child gets vaccinated, it's just like kind of preparing the body ahead of time so that if the child comes across these illnesses, it won't be as fatal as it would have been. And to the best of my knowledge, vaccine cost has been subsidized to the barest minimum. In fact, free in most parts of the world. Vaccines are free. And even if you have to pay for any reason anywhere, I'm sure they are very cheap. So I don't know what the misconceptions can be. Like I came across a woman who had 6 children and all 6 have not been vaccinated. And her fear is that she's scared that if they are vaccinated, the children might now, the vaccine will not kill the children. Vaccines don't kill. Hello, vaccines don't kill. They don't kill children. If they do kill children, then the government will not be telling us to allow our children to be given vaccines. So if you're like that woman I came across and I was talking with her and she said, I am scared because I don't want to lose my children because I heard that some children will be fine and when they have this vaccine, they will be killed. sorry, they will die. It doesn't kill children. Some other people think that some vaccines cause autism in children. Vaccines don't cause autism in children. So please, if you have doubts about vaccines and vaccinations, kindly meet your healthcare provider wherever you are. You can go to the health center, sit down with the nurses there and ask your questions. You can meet your doctor in the consulting room, sit down with your doctor and say, Doctor, please, I have some questions. I have reservations about vaccines. Can you clarify me on this? Some of us who use Android phones, you can use your Android phone and Google and update your knowledge or clear your doubts on whatever thing you think is your reservation concerning vaccines. Some children are still coming down with polio today. Polio has been eradicated, but there's still this wild strain of it that can still infect children. Get your child vaccinated. Please allow those children to be vaccinated. Vaccines don't kill children. Vaccines don't cause autism. If you have any further questions or reservations, I'll be glad to still know them and I'll try to clear them as much as I can. So please allow your children to be vaccinated. That is just the message of today. If you have any reservations or doubts concerning vaccine use, talk to your healthcare provider. Okay? Yes, talk to your healthcare provider. Talk to the nurses that are in the health center that are giving these vaccines. Talk to your doctors when you go to meet them. Get information from the right source. That is the essence of this channel. Get information from the right source. Don't tell me one woman told me. That woman is not an authority. Don't tell me my neighbor said. Your neighbor is not an authority. Your neighbor might not even know as much as you do. Your neighbor might also be one person that has reservations herself and she's telling you her own idea, not the correct information. So seek appropriate information from the ideal sources, from your nurses, from your doctors, and I'm sure they will clear your doubts and they will make you understand better why you should allow your children to be vaccinated. Remember that pregnant women, you should also take vaccines for tetanus when you're pregnant. You take the first one the first time you appear in the hospital, the next one after 4 weeks, the next one after 6 months, the next one after 1 year, and the next one after 1 year. 5 doses, you've completed it. The first time you book for your antenatal, 4 weeks after, 6 months after, 1 year after, and another 1 year after. 5 doses and you are immune. Okay, so please let's take this information home, share this video so that other people can also come across it, listen to it and learn also. So this is Dr. Angie saying